Caffeine has become an extremely popular ergogenic aid for athletes and is one of the most common drugs consumed by people all over the world. Caffeine is now appearing in energy drinks, sport gels, alcoholic beverages, and diet aids. As the popularity of caffeine has increased as a powerful ergogenic aid, so have ethical concerns. A number of governing bodies have caffeine on their banned substance list. However, caffeine has recently been removed as a banned substance from the International Olympic Committee and can now be consumed at a considerably low level that is acceptable under the IOC guidelines. The effect of caffeine is still very much unknown. The current literature differs greatly in their findings on the effects of caffeine, and there is no common consensus. Among the current literature, caffeine has been shown to be ergogenic during high-intensity exercise. Caffeine ingestion had no significant effect on muscular endurance, found the authors of one study. It has been found caffeine can allow athletes to train at a greater power output. Caffeine has also been shown to increase anaerobic capacity and time to exhaustion. In a conflicting study, the authors found caffeine had no significant effect on anaerobic performance. The sole study investigating the effect of caffeine on MAOD found a significant increase in MAOD and runtime to exhaustion after caffeine ingestion. Maximal accumulated oxygen deficit has been used as the gold standard to measure anaerobic capacity over the past 20 years. MAOD is the difference between the estimated total oxygen demand of exercise and the accumulated oxygen uptake. There is need for more investigation in this area of interest, as there is much interest around how athletes can continue to increase their MAOD to improve their performance in competition. The aim of this study was to investigate the effect of caffeine ingestion on MAOD. It is hypothesized caffeine ingestion will increase MAOD. 8 exercise and sports science students volunteered to participate in this study. All participants signed an informed consent and completed a revised physical assessment readiness questionnaire prior to any exercise testing. A cross-sectional study design was used for this study. Participants completed 3 sessions of testing on separate days. The first session required participants to complete a progressive maximal cycle assessment to determine each participant's maximum oxygen uptake. The participants cycled in 3-minute incremental workloads. The workload started at 60 watts and was increased by 60 watts at every 3-minute stage until exhaustion. VO2 max was calculated and the exercise intensities for the next session were determined. The next session involved a staged 6-minute progressive assessment at 30, 40, 50, 60, and 70% of the participants' VO2 max. From this data, the exercise intensity for the final session was calculated. 1 hour prior to the final session, 5 of the 8 participants ingested 3 milligrams per kilogram of body weight of caffeine. This study used no dose. Participants were required to cycle at 120% of their VO2 max for as long as possible until they reached exhaustion. Several protocols were required to be followed exactly during the 3 testing sessions. Participants began the session with a 5-minute rest while their expired air was collected. Participants then completed a 5-minute self-directed warm-up, followed by a 1-minute rest. Participants' heart rate and RPE were collected during the last 30 seconds of each stage in sessions 1 and 2. Once participants had reached exhaustion, they kept all equipment on for 10 minutes while expired gas was collected. And finally, blood lactate concentration was collected 5 minutes post-exercise. The equipment used in this study were 2 cycle ergometers, 2 gas analyzers, a heart rate monitor, and a handheld lactate analyzer. To determine the difference between caffeine ingestion and non-caffeine ingestion, an independent t-test was conducted to compare participants' MAOD results. An alpha level of 0.05 was selected to indicate significance. It is expected the caffeine will increase MAOD. The subjects who ingested the caffeine had a significantly greater MAOD than the control group. There was no significant increase in time to exhaustion or anaerobic contribution. MAOD post-blood lactate was not different between the caffeine group or the control group. The main findings from this study were that MAOD increased with caffeine ingestion. There was no significant increase in the cycle time to exhaustion for the subjects who ingested caffeine. There was no significant difference between anaerobic contribution between the caffeine group and the control group, and there was no difference in MAOD post-blood lactate between the 2 groups. The findings of this research are supported by research that also concluded caffeine increased MAOD. This study did not support previous research that found caffeine did increase cycle time to exhaustion and anaerobic capacity. Possible limitations of this study should be noted. Some of the expired gas readings were incorrect and were therefore excluded. This may mean other participants' readings could have been incorrect and influenced the results. As the incorrect readings were eliminated, one participant was required to complete sessions 2 and 3 again. This participant may have been suffering from fatigue. Other participants may have also been suffering from fatigue due to exercise testing that had been conducted during 3 days prior to this study. The caffeine dosage administered in this study may not have been a strong enough dose to see significant differences from the caffeine ingestion. A further limitation could have been that some subjects ingested coffee on the morning of this study. The effect of caffeine ingestion is a complicated area of research, with many conflicting conclusions. There are no set guidelines in this area of study, which makes testing especially difficult. Further research in this area of study could use larger sample sizes and a higher caffeine dosage than what was administered in this study to determine if caffeine does have an effect on anaerobic capacity. Further research could also compare the effect of caffeine on non-caffeine drinkers and caffeine drinkers to determine if people who regularly ingest caffeine are immune to the effects. Caffeine ingestion significantly increased MAOD, but did not increase cycle time to exhaustion, or anaerobic contribution, or post-MAOD blood lactate. Athletes are constantly trying to improve their performance to be better than their competition. Caffeine ingestion can now be ingested at low levels that are accepted under the IOC guidelines. Caffeine ingestion could prove to be an effective way to increase maximal accumulated oxygen deficit.